Good morning, everybody.
Good morning, doctor.
Students are entering. Let's wait 2 minutes.
Good morning, Professor.
So today we explain primary surgical treatment of the skull wounds and operation, which is performed on the skull, trepanation operation. The skull wounds of the skull are divided into two types of the wound. We have penetrated wounds and non-penetrated wound of the skull. What means penetrated wound? Penetrated wound means when there is trauma of the skull and there is damaged, is fractured the bones, and during the fracture of the bones is also damaged the dura mater. Do you hear me?
Yes, ma'am.
We were reconnected. Some problems. One moment. So we have talked about the types of the skull wounds. So we have told that we have penetrated wounds and non-penetrated wounds. So non-penetrated is the wound which during trauma is damaged only the bones of the skull. When we have trauma of the skull, first, before there is done any surgical intervention on the head, must be done röntgenography. If it is possible, must be performed computer tomography to identify the type of the trauma, and after that decide the treatment of the skull wounds. Aim of the primary surgical treatment of the skull wound is to stop bleeding from the tissues, to remove foreign bodies from the tissues of the head, and to avoid spreading of the inflammatory process. Before there is done intervention on the head, patient must be prepared for the primary surgical treatment. And for preparing of the patient starts by shaving hair on the head, which is performed from the wound to the peripheral part, so not to the peripheral part to the wound side, from the wound to the peripheral side, must be shaved the hair. After that, it must be washed by soap water and cleaned by antiseptic solution. And after cleaning of the operational area, we see that the operational area is covered by the linen. It is held by the linen holder to separate it from healthy tissues. And before there starts dissection of the tissues, must be performed the anesthesia. Anesthesia during skull wounds, it depends what type of trauma we have. So maybe used general anesthesia, maybe used local anesthesia. If it chosen the local anesthesia is performed infiltrative type of the local anesthesia, and infiltrative anesthesia in the tissues of the head is done in 3 stages. At first, anesthetic, so infiltrative anesthesia means when is performed saturation of the tissues by anesthetic solution in the area where is done surgical intervention. Yeah, it is performed for blocking the nervous ends. So anesthetic substances is injected in 3 stages. At first, anesthetic substances in the tissues are injected at the level of the location of the nerves. For example, if trauma we have on the forehead, anterior part of the frontoparieto-occipital region. So aim is to block supraorbital and supratrochlear nerves. So at the level of these nerves is done, the location of this nerve is done anesthetic substances. At first step, anesthetic substances are injected at the level where must be performed the incision, and incision which is performed on the head is radial type incision, which corresponds to the location of the vessels and nerves without damaging it. And at further step, anesthetic substances are injected under the muscular layer. So at this case, the needle is changed. So more thin needle is changed by thick needle, because aim is that anesthetic substances must be placed under the muscular layer. So more thick tissues must be first, and it is placed under the muscular layer at the level of the bone. And after making anesthesia is performed the incision. And the incision, what we have told, which is performed, is radial incision. Radial incision, which corresponds the location of the vessels and nerves, which is located in the tissues. We have told if we have trauma in anterior part of the head, yeah, is blocked this nerve. But if we have trauma in the temporal part, so aim of the anesthesia is to block auriculotemporal and zygomaticotemporal nerve. If we have in posterior part trauma of the frontoparieto-occipital region, aim is to block lesser occipital nerve and greater occipital nerves. So after anesthesia, we are making incision. The form of the incision must be elliptic form, because during recovery from the surgical operation, the edges of the incision must pull to each other easily for restoring the tissues during recovery from the operation. And when there starts incision, there is bleeding, yes, which must be stopped right away. Stopping blood flow from the vessels of the skull is used different methods. We know is used clamps for stopping bleeding. For more big caliber of vessel may be used what ligature procedure. Ligature, so to put knot on the vessel. This can be used on the superficial temporal artery, which is the thickest branch of the external carotid artery. If we have bleeding from the veins, diploic veins, so from the bone layer, it is stopped by inserting the honey wax into the tissues. If we have bleeding from the venous sinuses during penetrated wounds, it is stopped same way as types of methods of stopping bleeding from the vessels. So different methods can be used for stopping bleeding from the vessels. If we have penetrated wound, in this case, fractured fragments of the skull bones may be inserted into the bone parts of the cranial cavity. So in this case, removal of the foreign fractured fragments and foreign bodies from the parts of the brain can't be performed by the forceps during non-penetrated wounds. So when we have not damaged the dura mater and only we have fractured fragments in the soft tissues of the skull, it can be removed by the forceps, but during penetrated wounds, it can't be removed because during removal of these fragments may be damaged the parts of the structures of the cranial cavity. In this case, is done irrigation of the tissues by physiological solution. And we see on the picture is irrigation is done by physiological solution. So primary surgical treatment of the skull wounds is finished when we stop bleeding from the vessels, when we avoid spreading of infection into the tissues, and when is removed foreign bodies from the tissues. Trepanation. And when we talk about trepanation, trepanation means opening of the cranial cavity. Opening of the cranial cavity. Two types of trepanation we have, which is performed on the skull. We have craniotomy, which is also called osteoplastic trepanation, and cranioectomy, which is also called decompressive trepanation. What is differences between these two types of trepanation, and what is indication of this operation? Osteoplastic trepanation, craniotomy. Indication of this operation is when we have pathological process in the cranial cavity. So which pathological process? Maybe we have tumor of the brain, hematoma in the cranial cavity. So aim of the craniotomy osteoplastic trepanation is to open cranial cavity, to perform surgical intervention in the cranial cavity to remove that pathological process what we have there, and after operation finishes, the wound must be restored. Craniotomy, tomy means incision, yeah? Aim of the decompressive trepanation, which is also called cranioectomy, word tells us, yeah, cranioectomy. Ectomy, so is removed the part of the brain, removed part of the bone, sorry. Aim of the decompressive trepanation is a non-operable tumor of the cranial cavity when during non-operable tumor is increased intracranial pressure. So aim of the decompressive trepanation is not to remove pathological process because it can't be removed. It is non-operable. Aim is to facilitate the patient's stay. So surgical intervention is done for the purpose of decreasing the intracranial pressure, and this is done by removing of the bone flap from the skull. So decompressive trepanation is considered as a palliative operation. So we see this operation. First, we see osteoplastic trepanation. So osteoplastic is which trepanation? Osteoplastic is craniotomy operation. Now I show you the video, and during the video we explain these stages of the operation. Do we see?
Yes, yes.
So craniotomy, osteoplastic trepanation. During this surgery is done arch-like incision on the skin. Arch-like incision, horseshoe incision, where base of incision is projected upward. It is done above the area of the pathological process. During this operation is dissected tissues, and we get flaps of the tissues. We get flap of the soft tissues, and we get flap of the bone. Let's see now. Upward. If procedure is done at the level of the bronchial body, we can see on the skin is marked the level of incision. If procedure is done at the level of the frontoparieto-occipital region, so soft tissues flap consists of the skin, subcutaneous tissue, and the muscular layer. So flap of the soft tissue consists of these three layers. So these three layers are dissected at together. Why? Because it's impossible to separate these layers from each other, because we have told that fibrosepta, which is located in subcutaneous tissue, connects these two layers to each other very firmly. If procedure is performed at the level of temporal region, so soft tissues flap consists of skin, subcutaneous tissue, superficial fascia, and temporal fascia. subcutaneous tissue, abdominal tissue, and then starts similarly, which is called by by scalpel is dissecting the soft tissues, separated from outer lightly pericranium and is dissected the pericranium by scalpel. From the bone by raspatory. We see that this is raspatory, which is removed easily from the skull bones. Why? Because under the pericranium layer is located what? Fat connective tissue layer, yeah? Electric drill or manual drill, which is called a trepan. On the skull bone by this instrument is performed 4-5 holes. Distance between each holes is 4-5 centimeters. If the skull bone outer surface has a smooth surface, not to move the head of this instrument on the skull, is used spearhead to remove dissected lamina externa, and is shown the whole barrel, backbone, dissected here, and after dissection of the diploid layer is changed the head of the instrument by round-tipped head, and is dissected the deepest layer of the bone, lamina interna. After that, between these two holes is placed the special instrument, Poleanova's conductor, which has groove in the middle part, and in this instrument is placed the gills. So while like so we have studied dissected before. This is shown now gills. Now will be shown gills. This is gills. What we see. And by this instrument is dissected bone. Then is placed in other two holes. Besides holes, and we get bone flap. This is bone flap, which is removed from the wound down. So cranial tendon is opened. And is done surgical intervention with pathological processes. Now, pathological processes there, we are interested in the technique of the operation. How it's opened. So we see now how it's dissected the dura mater. Dura mater is dissected, is removed. So now is shown that pathological process, what is aim of this surgery, which must be removed. The tissues are shown. Where is the pathological process? So after dissection of the dura mater, is accessed that area. If there is increased intracranial pressure, cerebrospinal fluid is removed from decreasing the cranial pressure from subarachnoid space. Right? This is that pathological process which is removed from the tissues. So after is finished the surgical intervention, all these tissues must be restored layer by layers. First is sutured what dura by interrupted sutures. We see then is returned the bone flap in the wound and is sutured the periosteal layer, pericranium, and then the wound is covered by the soft tissues flap, which consists of skin, subcutaneous and muscular layer, and it is sutured by interrupted knotted stitches. So which trepanation is this, what we see? Do you hear me or not?
Yes, Professor, I can hear you.
So which trepanation we have seen? Osteoplastic trepanation, yeah? Other type of the trepanation, what we have told, cranioectomy, is called what? Decompressive trepanation also. Decompressive trepanation, so indication of this operation is what? Indication of the decompressive trepanation is non-operable tumor of the brain where is increased intracranial pressure. So surgical intervention on the skull is performed for facilitating the patient state. So that pathological process can't be removed, but surgical intervention is done for the purpose of decreasing the cranial pressure. So that's why cranioectomy operation is done. So bone flap of the skull is removed after the surgery, so it is not returned to the skull bone. Why? To perform the area of the contents of the cranial cavity to be the movable in the cranial cavity, not to increase the intracranial pressure. So during this operation, decompressive trepanation, when is a non-pathological process, it is performed above the pathological process is dissected the tissues. But if is not known, are cases that is not known where is located the pathological process in the cranial cavity. At this case, operation is performed in a right temporal region. So let's see this operation technically how is performed. We see the operation, yeah?
Yes, yes.
So is covered by operation linen, is done arch-like incision. Soft tissue's flap consists of same layers as during osteoplastic trepanation. Clips are used for stopping bleeding. We get soft tissue's flap during dissection. Then is dissected pericranium. During this surgery is used electric knife. This is electric knife. It provides dissection of tissues and also it provides stopping bleeding from these small vessels. So here completely is dissected the pericranium because aim of the surgery is what? The bone flap must be removed. By raspatory is removed the pericranium. And on the bone is done incisions. Yeah, here is used electric trepan during this operation. We have told two types of instrument. We have manual and electric. So at this surgery now are used electric trepan drill. We see for 5 holes is done by this instrument. Several holes is done during dissection of the bone. Here bone is dissected between 2 holes in different way. Why aim of this operation is to removal of the bone flap, we have told. Between these 2 holes is dissected the bone. This is elevator for removing the bone from the skull. And bone flap is removed. Yeah, ectomy is done of the bone. Aim of this intervention is hematoma, which is non-operable. It is inserted into the skull bones. So bone flap is removed for decreasing the intracranial pressure.
Professor,
Yes,
what is this the white thing that they added?
this is mesh, biological mesh, by which is covered these tissues because to perform artificial bone flap. Now, artificial bone flap must be placed there, and it can't be placed on the tissues of the contents. Yeah, so that's why it's placed the mesh below it. So ectomy is done, bone flap is removed, yeah? Why? To perform the large area for the contents of the cranial cavity. And is done artificial flap by which is closed that wound. So by this surgical intervention, that pathological process, what is in the cranial cavity, can't be removed. So surgical intervention is done for facilitating the patient's stay. So that's why this operation, decompressive trepanation, is considered as a palliative operation. Do we understand?
Yes, doctor.
Have we any question?
I have a question. When the surgeon make a holes in the bone,
Yeah.
how do we restore the bone of these holes?
Bone powder is used for filling this area.
Okay.
Bone powder was not shown in the surgery, yes, this procedure. Have we any question? Differences, we understand, yeah, from each surgery, what we have seen, craniotomy and cranioectomy.
Yeah, in the ectomy, the bone is removed completely.
So osteoplastic trepanation, craniotomy trepanation is performed. Indication of this operation is when aim is to remove pathological process which is located in the cranial cavity, but aim of the decompressive trepanation, cranioectomy operation is what? When we have non-operable tumor in the cranial cavity, and surgical intervention is done for the purpose of facilitating the patient's state. And procedure is done technically differently. Yeah? That is craniotomy operation, other one is cranioectomy.
Okay, thank you.
Okay, thank you. Goodbye, everybody.
Thank you so much.
Thank you, Professor.
Ma'am.
Thank you.